DCISionRT was previously validated in over 1,100 patients and 4 patient cohorts around the world. To achieve an even higher level of validation evidence, DCISionRT was validated in the landmark DCIS randomized clinical trial. In the trial, women were treated with breast-conserving surgery and randomized to receive radiation therapy or not. The study objectives were to validate DCISionRT's ability to identify women with 1. Elevated recurrence risk who benefit substantially from radiation therapy after breast-conserving surgery, or 2. Low recurrence risk receiving little benefit from radiation therapy. DCISionRT classified 52% of patients into the elevated risk group. Patients in the elevated risk group had a significant 70% relative risk reduction corresponding to a 9% benefit from radiation therapy in reducing 10-year invasive recurrences. However, there was a 1% non-significant difference from radiation therapy in the low-risk group. The results confirmed the high quality and consistency with all prior DCISionRT validation studies. As shown, absolute invasive risk-benefit from radiation therapy in the DCISionRT low risk was about 1.5%. Absolute invasive risk-benefit from radiation therapy in the DCISionRT elevated risk was about 9%. The clinical implications of this new information are summarized by Principal Investigator Fredrik Warnberg, MD, PhD, Professor in the Department of Surgery, University of Gothenburg, Sweden. In this study, DCISionRT demonstrated statistically significant radiation therapy benefit in patients with higher decision scores and minimal benefit in lower scores. This was a highly valuable use of biobanked tissue from the landmark DCIS patient cohort, as no other randomized studies have been able to identify DCIS patients who can omit RT. Additionally, study investigator Chirag Shah, MD, Director of Breast Radiation Oncology, Cleveland Clinic, said, "These comprehensive study results provide the highest level of confidence among physicians to fully adopt and implement DCISionRT to guide their treatment recommendations for patients with DCIS."